Good evening. Welcome to Sound Health on Lagos Television. I am Olasunbo Mudukwe. Today our focus is on menopause. Menopause marks the end of a woman's menstrual cycle. Experts say the irreversible changes in a woman's hormone can impact physical and mental health. Today, this is our focus once again, and my guest is on standby. You get to hear more about menopause. Stay tuned, the conversation begins after this break.
WHO has today issued a medical product alert for 4 contaminated medicines identified in the Gambia that have been potentially linked with acute kidney injuries and 66 deaths among children. 4 medicines are cough and cold syrups produced by Maiden Pharmaceuticals Limited in India. WHO is conducting further investigation with the company and regulatory authorities in India. WHO recommends all countries detect and remove these products from circulation to prevent further harm to patients.
This is still Sound Health on Lagos Television. Joining us via Zoom from Irrua in Edo State is Dr. Joseph Okoeguale, consultant obstetrician and gynecologist, Irrua Specialist Teaching Hospital, Irrua, Edo State. Good evening and thanks for joining us, Dr. Okoeguale.
Thank you, Modube, for inviting me to this talk show.
All right, Dr. Okoeguale, let our viewers know what exactly is menopause. I'm sure many have heard about this condition.
Okay, menopause is a term used to describe the permanent cessation of menstrual flow due to depletion of ovarian follicular activity. Menopause is said to have occurred when there is 12 consecutive months of absence of menstrual flow. The woman has previously established a menstrual pattern, and now she has had 12 consecutive months without menstruation. She is said to have attained menopause. The age of menopause is relatively constant worldwide. And the average age of menopause is just about 51 years. It could range between 45 to say 55. But the average age is about 51. It's constant. Menopause, physiological menopause cannot be postponed. Physiological menopause is constant at that age. It doesn't have any ethnic influence. It doesn't have so much environmental influence, that affects the physiology of menopause. So it's relatively constant. However, in certain conditions, menopause could occur at an age less than 45. If menopause occurs at age less than 45, say between 40 and 45, the woman is said to have attained early menopause. And some women too may attain menopause at age less than 40. For such women, we describe them to have had what we call ovarian failure. Yeah, those are some of the terms that we use. If complete cessation of menstruation for a period of 12 months occur before the age of 40, we will say that the ovaries of that woman has failed, as ovarian failure. If it occurs at an age less than 45, it is called early menopause. Average age for menopause is about 51 years in the industrialized world, but it could range between 45 to 55. It's constant and not much factors affect that age. The only factors that are triggered by age are the early menopause and probably those who have primary ovarian failure.
All right, Dr. Okoeguale, apart from cessation of the menstrual cycle, are there symptoms to also watch out for to tell us that, okay, fine, I'm experiencing menopause?
All right, there are certain symptoms that are associated with menopause. This could be early symptoms, this could be intermediate, and this could be late symptoms. The early symptoms of menopause are mainly vasomotor symptoms. Those vasomotor symptoms will include hot flushes, like some people complain of internal heat. They have some form of flushes of heat on the face, on the chest, on the back, typical of hot flushes. That will now be associated with profuse sweating. They sweat a lot. Profuse sweating, and then so we have difficulty with sleeping. We call it insomnia. These are very common in early phase of menopausal women. And then subsequently, they could begin to have a lot of urethral syndrome. There are specific symptoms we call urethral syndrome, ranging from painful urination to increased urinary frequency, increased pattern of urine at night, urinary dysfunction. Outside that, they risk the chance of having sexual dysfunction. The sexual intercourse are not as enjoyable as it used to be. The vaginal epithelium becomes atrophic, is strained, reduces in volume. So that sexual pleasure is so much not there. Some of them can even start feeling so much pain because of the little crack that they now have around the vaginal area. These are also common. And then late symptoms could come in form of so many things. Because of the demineralization, you need that estrogen to increase bone mass and all that. Because that's no longer there, they could have what we call osteoporosis. The bones become a bit weak, they are osteoporotic, and that happens. And then some other problem could follow, such as cardiovascular disease. Some of those things that estrogen was initially taken care of, repair of epithelium and all that. Because of the low level of estrogen, they begin to manifest symptoms of the deficiency of this estrogen level. So osteoporosis, cardiovascular disease, and a host of other conditions will arise much later in the life of women who have attained menopause. But it's important to state that just before menopause approaches, there's a period usually close to it, very close, just the preceding 10 years before the final cessation of that menstruation happens. That period is called the climacteric. During that period, the level of estradiol, the level of the estradiol begins to fall. And these women begin to have some of these early symptoms: internal heat, night sweat, hot flushes, and all that. They continue to have it, and it happens just years, can be 10 to 15 years before the final menstruation will stop. That period is called the climacteric.
All right, could use of medication trigger early onset of menopause in women?
Okay, like I mentioned, the age of menopause is relatively as a natural menopause, the physiological menopause. Now, certain factors can cause either early menopause or premature ovarian failure, just the way I defined it earlier. Now, for early menopause, women who smoke, increased level of smoking have been known to reduce that age, to contribute significantly, because what smoking does is this: it increases the hepatic metabolism of estrogen, and that will reduce the overall estrogen availability, estrogen level, and the woman may have early menopause. Now, certain medications, certain cancer therapy, like chemotherapy, radiation exposure, could actually affect the ovaries and reduce the ovarian age, causes a bit of ovarian failure, and the person starts manifesting menopausal symptoms. There are other medications that we use physiologically to control certain conditions, such as endometriosis, like the gonadotropin releasing hormone analog that suppresses ovulation so much. Such drug could produce symptoms, menopausal symptoms, or affect the age at which a woman may probably attain the natural menopause if used for a very long time. So these are some of the factors that could reduce the age. And then some procedure, like some surgeries, ovarian surgery that will include operation and procedures around the ovary, which affects the ovarian anatomy around the ovary, could predispose to ovarian problem and, of course, ovarian failure. So these are some of the factors that could impact on the natural age of menopause.
Tell us, Dr. Okoeguale, is this condition synonymous with women alone? Can it be seen in men too? Can men experience this condition, menopause?
The word menos means menses. Pause means cessation. Cessation of menses. Only women menstruate. Men do not menstruate. So the term menopause is synonymous with them. But there is another term used for male, the andropause.
Okay.
In which there's progressive decline of some of these symptoms, progressive decline of those male hormones, often leading to some symptoms which are not similar to what you will find in the females with menopause. So menopause is a word that is native, to women. It's synonymous with a description that is particularly used for women, not males.
All right. Many women complain about how this condition affects their health, lifestyle, and all that. Does it also affect mental as well as physical health now? Is there any correlation between menopause, mental health, our physical health, and emotional well-being?
Menopause comes with a lot of problems. Some are able to cope with the problem better than others. Part of this problem, the long-term consequences of menopause are psychosocial issues. When some of these symptoms I have mentioned earlier becomes exaggerated, they lead to a lot of psychological problems in the woman. Can you imagine a woman keep having hot flushes, keep having night sweat, keep having difficulty with sleeping, having urethral syndrome? It causes a lot of mental health issues because most of them may not be able to cope with their normal work activities. Most of them may not be able to cope with their normal day activity. The emotion is blunted, their sexual life is affected. So it comes with a lot of mental stress and mental activity. That is why psychosocial issues are part of the issues that are addressed in women who have exaggerated menopausal symptoms. It's part of the management strategy in women who are manifesting symptoms of menopause.
All right. Is this condition treatable? And if not, how do you cope or live with it? Because, as you said, it's part of a woman's anatomy now.
Yeah. Oh, well, menopause is a physiological condition which will happen to every woman. It will definitely come if the woman lives up to that age. However, some of the symptoms of menopause are exaggerated more in some women as compared to other women. Mm-hmm. So management varies so well. It could vary from just lifestyle modification to use of medication. Some of the lifestyle modification will include exercises. People who exercise frequently are known to cope better with the symptoms of menopause as compared to those who don't exercise too. Diet modification, and then proper medical care. As people grow, they are also bound to have certain medical conditions, hypertensive disorders, diabetic disease, even malignancies, cancers, and all that. So it's important that as you grow, as women grow, they properly take care, because a coexisting medical condition will worsen the problems of menopause. Diet too is also very important. controlled diet, healthy diet, avoid smoking. That smoking is very key. You see a lot of girls smoke these days, increasing by the day. We always encourage them to at least cut it down or avoid smoking. And then reduce caffeinated food and reduce alcohol intake. All these will help to improve the symptoms of menopause on a natural level. However, certain medications are known to be effective because we know that the problem of menopause is the deficiency, hypoestrogenic state. The estrogen level is down. Although progesterone level is down, but the estrogen levels are reduced far more than most other hormones during the period of menopause. So we try to replace the estrogen which has been lost. And replacement can either be through oral, then it can also be local, topical, and then there are many other ways it can be given. But what we usually do, because many women will complain of local symptoms, systemic symptoms, sexual dysfunction, urinary symptoms, application of vaginal tones and vaginal estrogen cream will help to take care of those local problems, improve sexual function and all that. And then use of estrogen pills, estrogen tablets could help to improve vasomotor symptoms, night hot flushes, night sweats, and other things that follow, improve bone mass, and a couple of other symptoms that follow the period of menopause. But these drugs also have their few side effects. They also have their side effects, and we understand that the fear, there's usually this fear of the possible side effect of some of the medications. One of those fears is the propensity increase in the risk of probably causing certain form of cancer in some people. One of it is endometrial malignancy, the cancer of the womb, and sometimes breast malignancy and all that. But over time, it's been shown that the risk is not as high as many people think. And so you know that it's difficult by the time you finish counseling a woman and tell the person that this one poses a slight increased risk for you to develop certain malignancy. The chances that that person will agree to take some of those medications become so low. So those are usually some of the problems we find when we are counseling them in our clinic. And it's important. We try to enlighten them, and that's what we currently do, to tell them that yes, some of these medications are safe, and when they are safely given, it will help improve most of these symptoms that they are currently having.
Healthy lifestyle will help you pull through, will help you cope well with menopause. Dr. Joseph Okoeguale, thank you so much for your time. We really appreciate you. Dr. Joseph Okoeguale is a consultant obstetrician and gynecologist with Irrua Specialist Teaching Hospital, Healh in Edo State. Thank you so much for your time once again, Dr. Okoeguale.
Thank you.
All right, it is still Sound Health on Lagos Television. And we now take a look at trending health report from around the world. Please stay tuned. we say thank you on today's episode of Sound Health. Healthy lifestyle will help you through any health condition, especially menopause. Live a healthy lifestyle. Follow the right diet, follow the right prescription by your healthcare provider, and you will be fine. For comments and inquiries, please send SMS to 0035826603 or follow us on social media at Healh TV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.